All right, in this chapter we'll be talking about patients with special challenges. So we'll apply the fundamental knowledge, growth, development, aging. Assessment findings provide basic split advanced emergency care. Transportation for a patient with special needs. All right, some healthcare implications of abuse, homelessness, poverty, bariatrics, technology dependence, tracheostomy care dysfunction, hospice, home care, sensory deficient loss, developmental disability. Then we'll also be looking at trauma and how to care for these patients. And trauma of pregnant, pediatric, geriatric. And passed out of the pregnant, pediatric, geriatric, and cognitively impaired patients. So the patients with special needs are children who are born prematurely, infants or small children who with congenital heart disease, patients with neurologic disease, patients with congenital or acquired diseases, patients with sensory deficiencies, and geriatric patients with chronic disease. Insufficient development of the brain resulting in some level of dysfunction or impairment, intellectual disability, inability to learn or socially adapt to normal developmental rate. Some causes are by genetic factors, congenital infections, complications at birth, malnutrition, environmental factors, prenatal drug use or alcohol use, traumatic brain or poisoning, and they may appear to slow to understand, behave immaturely, and not have the ability to care for themselves, communicate, understand, and respond to surroundings. So let's look at autism. Autism is a complex disorder that varies greatly in signs and symptoms. It's characterized by impairment of social action, severe behavioral problems, repetitive motor activities, verbal and nonverbal language impairment, and have medical needs similar to those of their peers without autism. Down syndrome is a genetic chromosomal defect that occurs when two 21st chromosomes fail to separate during fetal development. Increased maternal age and a family history are known risk factors of Down. Some physical abnormalities are a round head with a flat occipital, an enlarged protruding tongue, slanted wide-set eyes, folded skin on either side of the nose, a small face and features, congenital heart defects, thyroid problems, hearing and vision problems. Patient interaction: treat your patient as you would any other. Have your team members wait until you can establish a rapport with the patient and soothe the patient's anxiety and discomfort as you work through assessment and treatment. All right, brain injury patients may be difficult to assess and treat. Obtaining a complete medical history from the patient, family, and friends will be helpful. So talk in a calm, soothing tone, and watch for signs of anxiety and aggression. Do not expect the patient to walk to the ambulance or stretcher, and treat the patient with respect. Sensory disabilities, visual impairment, possible causes or congenital defect, disease, injury, infection, degeneration of the eyeball optic nerve or nerve pathway. It may range from partial to total. You may lose peripheral or central vision, and some can distinguish light from dark or discern general shapes. It may be difficult to recognize. Look for signs that indicate the patient is visually impaired. As you can see, there's a seeing eye dog here, also a cane here. Immediately introduce yourself when you enter the room with these patients. So have team members introduce themselves also. Retrieve individual aids and give them to your patient. Patient ambulation, they may use a cane or a walker, so take it with you. Unless it's a critical situation, the service animal can remain with the patient. An ambulatory patient may be led by a light touch on the arm or elbow, or the patient may rest his or her hand on your shoulder. So ask the patient which method they use. Gently guide, but never pull or push, and communicate obstacles in advance. Hearing impairment may range from a slight hearing loss to total deafness. May have difficulty with pitch or in volume. Some learn to speak even though they have never heard sound. Disease processes may cause patients to slur words, speak very slowly, or speak in a monotone. Most common forms of hearing loss is sensory neural deafness that results from nerve damage, most common form, and may be caused by a lesion or damage on the inner ear. Elderly persons will have some degree of sensory neural hearing loss. Conductive hearing loss, faulty transmission of sound waves, can occur with an accumulation of wax within the ear canal or a perforated eardrum. Clues that a person could be hearing impaired: presence of hearing aids, poor pronunciation of words, and failure to respond to your presence or question. Communication. Face the patient while you communicate. Do not do not exaggerate your lip movements or look away. Position yourself approximately 8 to 10 inches directly in front of the patient. Most people who have hearing impairment have learned to use body language, so never shout. You may want to become familiar with the American Sign Language. Some helpful tips: if indoors, then adjust the lighting so the patient can see you. Face the patient and speak slowly and distinctly. Change speakers. Provide paper and a pencil. Have only one person ask interview questions. And try the reverse stethoscope technique. So have your patient put the stethoscope in their ears and you speaking into them. Here's some common terms from the American Sign Language. Hearing aids cannot restore hearing normal, only improve hearing with learning disability. Okay, so several types: behind the ear, conventional body type, in the canal and completely in the canal, in the ear, and implantable options are also available for patients with hearing loss, with less profound hearing loss. Have the patient insert their hearing aid, follow the natural shape of the ear. The device should smoothly fit without forcing it. If whistling sounds occur after the device is inserted and turned on, the hearing aid may not be in far enough or the volume may be too loud. If you cannot insert the hearing aid after 2 tries, put it in the box and take it with you. Never try curling in hearing aids, and if the hearing aid is inserted correctly but not working, troubleshoot with the following: make sure it's turned on, try fresh battery, check the tubing to ensure it's not twisted or bent, make sure that the switch is set to on or M, which is the microphone. For conventional hearing aids, try a spare cord and check ear mold to make sure it is not plugged with earwax. Here's some different types of hearing aids. One note about hearing aids, I know personally these things are getting very expensive and people become very possessive of these things. So if you do see them, please keep them with the patient all the time to make sure that they can see these hearing aids. Also, some things with sensory disabilities, especially blindness, and some of these people use other senses to help guide them. So if you do have a blind person, a partially blind person, they'll use certain sounds, such as fans running, music playing. If they're partially blind, also they use touch really well. So you may walk into a home that looks like it's been destroyed. However, this patient uses those touches. They know that a road might be turned up under a little bit, so when they kick it, they know where they're at. The touch of certain kinds of cloth and material. They know they may be going by a leather chair or a wood chair or a cloth chair, and a certain kind of cloth. So they may have a radio playing towards their kitchen area, They may have a certain fan that's flowing according at a high speed in a certain area of the house. So you may walk into a home and think that something's really bad, or this may be a concern or fall risk. However, these patients know that these certain things are being done to help them navigate through their home. All right, cerebral palsy is characterized by poorly controlled body movement, possible causes of developmental brain defects in utero, traumatic brain injury, infection during the neonatal period or infancy, and genetic causes. Symptoms associated in conditions, spastic movements of the limb, inability to maintain proper posture, visual and hearing impairments, difficulty communicating, epilepsy, intellectual disabilities. So they will have various levels of mobility. Grimacing and uncontrolled movement may take speaking difficult and speech hard to understand. Many use computerized household controls, speaking aids, or motorized wheelchairs. So when assessing their ABCDEs, it's important to observe airway closely. May have increased production and secretion of dysphagia. It may require aggressive suction to clear the airways. Important considerations: do not assume that all these patients with cerebral palsy have an intellectual disability. The limbs are often undeveloped and are prone to injury. Patients who have the ability to walk may have an unsteady gait and prone to falls. If the patient has a specially made pillow or chair, the patient may prefer to use it during transport. Pad the patient to ensure his or her comfort and never force a patient's extremities into any position. Take walkers or wheelchairs along during the transport, and approximately 25% of these patients with cerebral palsy also have epilepsy. Cystic fibrosis is characterized by increased production of mucus in the lungs and digestive system. Diagnosed in infants and young children, it's caused by a defective recessive gene inherited from each parent. Prone to development of venous thrombosis. Permanent manifestations include pneumonia, pneumothorax, cough, respiratory stress, and respiratory failure. Malnutrition and a poor growth rate are common, often causes death in childhood due to chronic pneumonia. Receive frequent or continuous treatment with antibiotics. Medical devices promoting lung function and removal of mucus may also be used. Maintain the airway, provide O2 and suction as needed. Humidified oxygen may help thin mucus and improve respiration. Multiple sclerosis, severe incurable degenerative disorder involving central nervous system. Sources describe this connection between genetic predisposition, environmental factors, and possibly nutrition are exposed to particular virus. Strike women in the 20s to 40s 2 to 3 times more often than men. Patient reports periods of varied improvement followed by relapse and progression of disease. A vast array of signs and symptoms related to neurologic dysfunction are possible. Skin breakdown may result from immobility or poor positioning. Life expectancy may be normal, but symptoms may cause significant disability or impairment. Manage with medications, physical therapy, and counseling. Allow additional time for assessment due to cognitive or communication barriers. So your supportive measures are hydration, analgesics, or muscle relaxing medications. Careful patient position and assisted ventilation when indicated. All right, muscular dystrophy, incurable genetic disease that causes a slow, progressive degeneration of the muscle fibers. Severe manifestations of certain specific diseases, cardiomyopathy, cognitive impairment, and respiratory compromise. DMD is most common type and chiefly affects males. Treat limited to careful positioning, supportive treatment, and assisted ventilation. Spinal bifida, birth defect caused by incomplete closure of the spinal column, resulting in an exposed portion of the spinal cord. Opening can be closed surgically, but the child is often left with spinal and neurological damage. Some patients with spinal bifida may have partial or full paralysis of the lower extremities, and loss of bowel and bladder control. Latex allergy is common, so latex-free products should be kept on hand. Paralysis, possible stroke, causes of stroke, trauma, birth defects. Types of hemiplegia, paralysis of one side of the body, possibly from a stroke or head injury. Paraplegia, paralysis of the lower part of the body, possibly from a thoracic or lumbar spinal injury or spinal bifida. Quadriplegia, paralysis of all four extremities and the trunk, possibly from a cervical spine injury. Paralysis, patients with dysphagia may easily choke or aspirate food or drink. Paralysis of the respiratory muscles causes patients to be completely dependent on a mechanical ventilator or similar device. Decubitus ulcers are a constant threat. A risk for a life-threatening condition on autonomic dysreflexia. Stressor within the body triggers a large release of catecholamines from the autonomic nervous system. External devices such as a halo vest are used to mobilize the spine. And that's the halo device like you see in this picture. So these patients are susceptible to environmental extremes. So do not always entail a loss of sensation. For a patient with a priapism, maintain privacy and continue to provide supportive care. Schedule urinary catheterization is required for many patients. Total lifting assistance required for patients with quadriplegia, so use the gentle touch when lifting or moving. Provide IV access to medications on the non-effective side whenever possible. All right, bariatric patients, obesity is a condition in which a person has an excessive amount of body fat. Bariatric patients exams cause prevention and treatment. Causes are not fully understood and often attribute to low metabolic rate or genetic predisposition. Obese is used when someone is at 30% over or more his or her ideal body weight. Clinical concerns for the patient with obesity: airway procedures are more difficult, larger tongue, larger head size, and limited neck mobility. Diaphragmatic ventilation may be ineffective. Here for IV access is problematic. Many IM needles will not be able to reach the IM space, and difficulty determining the extent of the injury. Interaction with patients with obesity: patients may be embarrassed or may be fearful or ridiculed as a result of past experiences. So put the patient at ease. Many of them have complex and extensive medical history. If transport is necessary, plan early for extra help. Send a member of your team to find the easiest and safest exit. Interaction with patients with morbid obesity: treat the patient with dignity and respect. Ask the patient how best to move him or her before attempting to do so. Avoid trying to lift by only one limb. Coordinate and communicate all moves before starting to lift. If the move becomes uncontrolled at any point, stop, reposition, and resume. Look for pinch or pressure points from equipment. And very large patients will have difficulty breathing, lying supine. Many manufacturers now make specialized equipment, so plan egress routes to accommodate patients' equipment and lifting crew members. So also you need to notify the receiving facility early. Obstruction of the tube is a life-threatening emergency, so use the DOTE mnemonic. Assess the airway, assess for flow of oxygen, ensure sufficient oxygen, and to suction and clean the tracheostomy tube. Mechanical ventilators are patients who have an underlying respiratory drive. So assess these patients' chest for synchronous movement with the ventilator. A tracheostomy collar is an oxygen delivery device for the patients with tracheostomy. Patients using home mechanical ventilators require assisted ventilation throughout transport. Avoid adjusting home ventilator settings unless you're specifically credentialed to work with the particular device. Apnea monitors are used when the infant is born prematurely for 2 weeks, 2 months after birth. Designed to sound an alarm if the infant experiences bradycardia or apnea. attached with electrodes or belt and wrapped around the chest and stomach. Patients may be able to provide a computerized correction. Parents may be able to provide a computerized printout. All right, internal cardiac pacemakers implanted under the skin to regulate heart rate, placed on non-dominant side of the chest, may also include a defibrillator. So never place defibrillator paddles or pacing patches directly above or over the device. Left ventricular assist devices take over the function of one or both the heart ventricles, used as a bridge to heart transplantation while a donor heart is being located, or has a permanent solution for patients who do not qualify for a transplant. Patients should have a go bag and must always be transported. Risk factors include, with an LVAD, include excessive bleeding. LVAD may be functioning in the absence of a palatable pulse. A lot of times these patients will not have a pulse. You will not be able to find a radial pulse. The family has been very trained with these patients now, so they a lot of times have a go-to person in which they can call, and they will make contact with a local receiving facility so that they can either know what's coming in to them and how to treat it, or if they have a room or space at that facility which gave them to this patient, gave the LVAD to this patient. External defibrillator vest, built-in monitoring electrodes, the defibrillator pad attached to a monitor that provides alerts and voice prompts. So avoid contact with the patient if the device warns that it's about to deliver a shot. The patient's cardiac arrest, then the vest should remain in place during CPR. Intra-aortic balloon pumps used in patients in cardiogenic shock, decreases myocardial oxygen demand, reduces cardiac workload, and improves systemic circulation. Bulky and difficult to move and secure in an ambulance. And these are pretty big machines. However, they are starting to become more compact, so I wouldn't be surprised if they start sending these home. All right, central venous catheters located in the chest, upper arm, and subclavian area, increased risk for cardiovascular complications. Inspect and secure all external devices before moving the patient. Gastrostomy tubes, referred to as gas tubes or G tubes, placed surgically through the abdominal wall. Patients may still be at risk for aspiration. Give supplemental O2 as needed unless the gastric tube is dysfunctional, dislodged, or partially dislodged. Continue tube feeding and transport the pump with you. Shunts for patients requiring neurological conditions. For hydrocephalus patients, a shunt extends from the brain to the abdomen or heart to drain excess cerebral spinal fluid. A ventricular peritoneal shunt drains excess fluid from the ventricle of the brain into the peritoneum. A ventricular atrium shunt drains excess fluid from the ventricles of the brain into the right atrium. Keep pressure in the skull from building up, and the fluid reservoir may fill during patient assessment. It is beneath the skin on the side of the head behind the ear. So if it's blocked or infected, changes in mental status, respiratory rest, infections may occur within the first 2 months after insertion. Intracranial pressure may increase. All right, signs and symptoms of distress: bulging flat nails in infants, headache, projectile vomiting, and all of these listed below. So care includes airway management and artificial ventilation. All right, vagus nerve stimulators used for seizure not control with anti-epileptic medications, used in conjunction with medications to reduce frequency of seizures. It's not meant to replace medications that are not currently used in children under 12 years old. Surgically implanted under the patient's skin and can last up to 6 years or until the battery runs out. Colostomy, ileostomies, and urostomies. A colostomy is surgical opening between the colon and the surface of the body. Ileostomy is surgical opening of the ileum and the surface of the body. So assess for signs and symptoms of dehydration if the patient reports diarrhea and vomiting. Patients and caregivers must be diligent with daily hygiene and a ureostomy surgical procedure that connects the urinary system to the surface of the skin. So be careful with those patients also. Understand what those ostomies do and what the output is coming in through those bags. So PPE is very important. Assess the patient's baseline vital signs, noting allergies, medications, and other pertinent medical history. Determine the patient's normal baseline status. Use short, simple questions and simple words. Home care, widespread special health care needs. Patients may be infants, be elderly, have chronic illnesses, and have a developmental disability. Services include meal delivery, house cleaning, laundry, yard maintenance, physical therapy, personal care. Home care provider found patient injured or recognized a change in mental status. Home care providers are a very important resource to obtain baseline health status and history of present illness and condition. You may go to these patients multiple times, but that home care provider is going to know what's normal for that patient. So if they see something acutely changing, they need to be transported. These patients need to be transported so that they can be evaluated further. So try to take all the necessary healthcare documentations and medications with you. All right, hospice patient, terminally ill patients, comfort care and palliative care during a person's last days. So these patients present with many different illnesses. Terminally ill patients usually only supportive care. So the patient may have a complex array of pain medication management devices. So you may need to consult medical direction for guidance. If called to a facility that provides hospice care, you need to follow your protocols, patient wishes, and legal documents such as the DNR, living will, or doable power of attorney in most forms also in the state of North Carolina. Even if a DNR order is in place, family members may not understand what to do or may not be ready to face the death of a loved one. So obtain a thorough history and compassionately discuss the patient's wishes. Ask to review DNR order and contact medical control if needed. Call to a scene in which death is imminent. Show compassion, understanding, and sensitivity. And some things may be chaotic. So assert the family's wishes regarding transport. Allow the family members to accompany the patient if he or she wishes. If the family wants the patient to remain at home, honor the request and provided is in accordance with local protocol. Okay. Now understand your local protocols and following these DNRs. Families will have different feelings amongst different feelings about that DNR. But however, that if it's signed, should be the patient's wishes or the power of attorney of the medical part of the patient's wish. All right, people who live in poverty are unable to provide for all their basic needs, including all the following. So homelessness occurs when people are unable to acquire and or maintain affordable housing. So be an advocate for the patient's rights and appropriate care, provide emergency medical care and transport to patients to the appropriate facility. Okay, your role may expand to include telephone service advice to 911 callers, preventative care, chronic disease management, and post-discharge follow-up. That's the end of this chapter. Can be temporary or permanent. Laryngectomy is a surgical procedure in which the larynx is removed. Do not introduce liquids into the stomach. Patients with laryngectomy cannot produce normal speech and must learn to swallow and regurgitate air from the stomach or any assistive device. Patients with a tracheostomy tube, those who depend on home automated ventilators, and those who have chronic pulmonary conditions.